I'm Dr. Neil Skolnick, professor of family and community medicine. And joining me today is Dr. Anjali Shah, who is a clinical assistant professor in the Department of Ophthalmology and Visual Sciences at the University of Michigan Medical School Kellogg Eye Center. Welcome, Anjali.
Thank you, Neil. It's so nice to be here.
Yeah, Anjali, you co-authored a paper, a chapter titled Disparities in Diabetes-Related Retinal Disease and Approaches to Improve Screening Rates, that was published by the American Diabetes Association in a compendium, a practical guide to diabetes-related eye care. Can I ask you, what is the single most important thing that you'd like our colleagues to understand from your chapter?
Um, okay, well, I think the single most important thing is to understand that disparities in diabetic retinal disease are real. And they run along racial lines, ethnic lines, and sociodemographic lines, such as income and education status. And by far the most important thing, once you've understood that they're real, is that there are things that we can do to make them better and to address them.
It's such critically important information. And to make it real, things that we can address. Are there disparities not just in the end result of diabetes related retinal disease, but are there disparities in screening? That's where we fit in, right?
Yeah, I mean, there's definitely disparities in screening. And I think what most people don't understand is that when patients early on in diabetic retinopathy, it's very asymptomatic. And so screening exams are essential for detecting disease early. And early detection and identification of disease and early intervention in diabetes related retinal disease can lead to a 94% reduction in vision loss. And that is a staggering statistic that really underscores the importance of screening exams. Screening as a whole in the United States across our population is less than ideal. I think only about 50% of patients get screened as they're supposed to be. But however, those numbers are even worse in minority populations. So, in the past, there was a recent study that was done that showed between 2002 and 2009, while screening rates for white patients actually increased a little bit, screening rates for minority patients decreased. So, we really need to do a better job of getting some of our minority patients, and I should also add patients from low income or rural geographic areas or those with lower health literacy. All of those patients tend to fall really behind when we look at screening.
Yeah, these are critically important issues. Let's go to what strategies might we do to improve the rate of screening. Let's start with just clinicians and patients. What can we do? What can our patients do?
Yeah, I think we as clinicians really need to make sure we're well educated about the importance of screening, about what the recommended screening guidelines are. I think all of us can improve our cultural competencies when dealing with certain minority populations, making sure that in our clinics and in our offices we have educational materials or people that can speak or provide information to patients in their native languages, and understand truly some of the more unique barriers that some of our patients from minority populations face when it comes to screening and accessing care. I think the other thing that's really important on a patient and physician level is also really educating our patients, making sure they understand the importance of screening for diabetes related retinal disease, make sure they understand the risks of not having that screening done, and really trying to motivate them to take an active role in their own care.
Critically important. Obviously, a complex issue. Can we just touch on what are some of these system level things that can be done?
Sure. I think on a system level, at a health system level, many of these larger health systems are doing a great job of creating patient registries and collaboratives, and then really utilizing and leveraging the power of that electronic health record to make sure that we are targeting patients and setting up reminders for patients and providers to ensure that their screening gets done.
For those of us who are not aware of it, can you just mention a little bit about retinal imaging in primary care and endocrinology offices?
Yeah, this is a fantastic opportunity for us to address some of those really really important and really impactful barriers to for patients at the patient level, such as transportation and needing to schedule additional appointments and access to our eye care providers. This is a system in which cameras are placed in primary care provider offices, and those cameras are used to obtain retinal images at the time of a primary care office visit. Those images are then transferred to an eye care provider who is off-site somewhere and interpreted. And it's a great way to get screening done at the point of care, right when you have that reminder pop up on your EHR. It saves patients an additional appointment. It saves patients an additional visit, transportation costs, etc. And so it seems like a no-brainer for increasing retinopathy screening. There are some issues. It's been implemented around the world and at home and at the VA health system very successfully, and has been shown to be cost effective in those systems. However, as it currently stands in community-based clinics, we do face some challenges in terms of really low reimbursements for those procedures, as well as the high cost or investment required to purchase cameras and train staff and set up those systems to communicate between eye care providers, primary care providers, and the patient.
So it's really an incredibly promising area for us to know about. More to come in that area. Dr. Anjali Shah, thank you so much for sharing such important information.
Thank you so much for having me.
This video is part of a project on diabetes-related eye care, and it's supported by an unrestricted educational grant to the American Diabetes Association from VSP Vision Care and Regeneron. For more detailed information, feel free to download our associated compendium. The address is below, a practical guide to diabetes-related eye care, available at diabetesjournals.org/compendia. For the American Diabetes Association, I'm Dr. Neil Skolnick.